Good morning. I hope you can hear me. Okay, right. So we are 15 minutes late. I hope or the demonstrator informed me that I can take your tea time. I don't know you are happy, but I have to continue more than 45 minutes. So that's what I have two options: either postpone it or continue further down until 10:45 or so on. Uh, I hope you can hear me. Let's say I call the demonstrator again and ask. ඇහෙනවද lecture එක? ඇහෙනවනේ. Okay, right. Right, okay. We can hear you. Mic is not working. We can hear you. Right, okay. So I hope you can hear me. So these are the intended learning outcome. Okay, these are the intended learning outcome, and you can read leisurely. Right, so relevancy. So this is basically electrical property of heart muscles and SA node or conductive system or pacemaker potential. So there are many drugs. These drugs will act on different places of the conductive system. As example, some of them work on SA node, and some drugs like calcium channel blockers will alter the electrical property. So this understanding about this property is important to understand the action of these drugs. Of course, to understand the basic behind the ECG. So this is the relevancy. And just to refresh your knowledge about the electrical property of the nerve cell, right? So you learn in the foundation module, probably you remember resting membrane potential, then with some sort of external influence, external energy will make it to threshold or firing level, right? So when it comes to the threshold, uh, sodium, voltage gated sodium channel will open and it polarity alter, we call depolarization, and then repolarization will start with the voltage gated potassium channels, and then polarity change, and then we have hyperpolarization. So a state of hyperpolarization. So this is what happened in the nerve cell, and their resting membrane potential is about -70 and threshold is about -55. And these are the different ion channels, and you learn this in your previous foundation module. So this one is the electrical property of the myocardial cells. So here you can see resting membrane potential and the threshold. And here we start with the resting membrane potential. This value is -90, right? Of course, here also we have threshold, but it is not commonly mentioned. Of course, with the external energy, external influence, uh, it will reach to the threshold. Threshold is about -60, -70, somewhere here. And then sodium, voltage gated sodium channel will open, right? So like it happened here, this depolarization part is due to sodium influx or movement of sodium ion into the cell through the voltage gated sodium uh, channels, right? So this part, then it's the voltage gated sodium channel action or sodium influx or sodium movement into the cells stop with, of course, it's a very short lasting channel, right? Then when this, with the cessation, with the closing of sodium, voltage gated sodium channel, this voltage value, when it comes, it's like plus value. We start with the -90. So this plus with the cessation, no, with the stop, with the closing of sodium channel, this polarity start to go down, right? So just closing the sodium channel, right? So then when it start to going down, some other channel will open, that is calcium channel. So that is not there. Here we don't have calcium channel. We have just sodium and potassium. So here we have calcium channel. So somewhere here, calcium channel will open. So we know that calcium concentration is high outside the cell. So it's when voltage gated calcium channel open, calcium should move from outside to inside. So calcium influx. So calcium will move, that means positive ion will move into the cell, right? So since positive ion start to move into the cells, this reduction is some sort of delayed, right? Of course, this reduction is, of course, facilitated with this one, like it here, potassium, opening of potassium ion, potassium channel. Potassium, as you know, if the potassium ion channel open, potassium will move outside because high concentration of potassium. So potassium start to move outside. That means plus ion will move outside. So therefore, inside start to become negative. So this is going down as it happened here, right? Potassium efflux. So movement of potassium ion to outside will occur, right? So that will occur. That will start somewhere here. But this movement of getting it negative or going down will be temporary, slow, temporary, prevented by opening of calcium channel, because calcium will move opposite direction, plus ion will move opposite direction. So because of this calcium ion, calcium channel, we will get this type of horizontal line we call plateau pace, some sort of plat, right? Otherwise, it should go down, push down. But it is prevented by this calcium ion, and we have plateau pace or plat pace in the electrical property of myocardial fiber. So we have this plateau pace, and then of course potassium efflux, so movement of potassium ion outside, moving plus ion outside will occur, and it will come back to the resting membrane potential as it happened here. This part is there, but only thing we have calcium ion that will make it flat, right? That will make it delayed repolarization. You know, this is depolarization. This is repolarization. So repolarization is delayed by calcium ion and make it a plateau phase, right? So that is the, when it compared to nerve cell, that is, or when it compared to skeletal muscle cells, you will learn it later. That is the difference of in the cardiac muscles, right? We have this special plateau pace, and it will make it it make action potential will last considerable longer period. So you can see here it's a very short from here to here. But here it take longer period because of this calcium ion channel make it repolarization. It's a slow process, right? So that is something you need to understand. Just to summarize again, we have sodium influx up to here, then sodium influx will stop. That will facilitate reduction, or that will initiate uh, repolar, repolarization, and of course start the potassium efflux, so movement of opening of potassium ion, and that will make repolarization. But repolarization is delayed by the calcium ion channel, and of course calcium ion channel will close, and then potassium will be dominated and repolarization will complete. Right. So resting membrane potential, depolarization, plateau phase, and repolarization. Of course, as you learned earlier, the time that the open duration of the potassium ion channel last longer than the sodium. Sodium is a very quick. So here you can see that you can see here the same thing. Sodium ion channel, keep it open very short period. Only move it up to here and it close here. Then of course calcium ion channel open and together with potassium ion channel open, right? Because of that it will go down, but calcium ion will keep it flat for considerable period, and then of course potassium channel kept open and go down, right? So here you can see opening time of sodium channel, calcium channel, and potassium channel. You can see sodium channel opening time or duration wise very short, very, very short. And potassium ion, long lasting, considerably long period, right? And calcium also considerably long period, right? So read that in the Gannon and try to understand what happened in the myocardial cells, electrical property of the myocardial cells. The later in your musculoskeletal module, you will learn more about the exactly same thing, what happened in the skeletal muscle, right? Skeletal muscles also, we don't have this space, right? In the next lecture also, I will explain what happened in the skeletal muscle. And that also just depolarization and repolarization. Right. Okay. Since since this is a projected lecture, I don't have chance to ask the questions, right? So that is a disadvantage. Right. So with the calcium influx, so here you can see in this time we have considerable period, we have calcium influx. Here we have calcium influx for considerable period. So actually with this calcium influx, I will explain in your next lecture, contraction of the muscle, so action or interaction of actin-myosin will occur. Actin-myosin interaction will occur when we have this, when we get the calcium into the cell, right? Calcium ion will move into the cells and that will contribute to this depolarization, repolarization process, as well as contraction of the muscle, myocardial cells. You know, I think you learn in the advanced level actin-myosin interaction in the muscles. So of course, you learn in the foundation module also. So this calcium will facilitate this actin-myosin interaction, and that way cardiac muscles will contract. Right. So this is the electrical property of the cardiac muscles, and this is the mechanical property where contraction of the muscles will occur. And of course, in the cardiac muscles also, we have absolute refractory period, relatively refractory period, and I will explain it in the next lecture. Of course, you learn about the refractory period in the foundation module. because of this plateau phase, we have long refractory period, prolonged refractory period in the myocardial cells. And we have advantage of having that. And of course, this plateau phase has several advantages. And as I mentioned earlier, calcium will enter into the cells. We have T-tubular system. I hope you remember T-tubular system in your foundation module when you learn about the structure of the muscle. Throughout the muscles, we have a special tubular system. We call T-tubular system. That system is like a extension of extracellular space. So if this is the cell and this is the extracellular space, so extracellular space will extend through the T-tubular system throughout the muscle. Through this T-tubular system, we can send calcium into the cell. Right? Quickly, large amount of calcium we can send into the cells because of this system. It's like a extension of extracellular space into the cell, right? So extracellular calcium we can pump quickly into the cells, and that will help to contraction of the muscles. So I will explain this in your next lecture. Right. So then about this depolarization. This depolarization is related to myocardial fiber, right? In the heart, we have pacemaker cells, right? So pacemaker cells, I don't know whether you learned already. We have SA node, AV node in the heart, right? Maybe you had some anatomy lectures, so you will have. And this SA node and AV nodes are, we call pacemaker cells, right? They will really generate the rhythm, right? So externally, we need not to send the rhythm to heart, right? So as example, you know that when we want to expand the lungs, skeletal muscle will act and some other pleura and so on act. So all these depend on external impulse. We need to send nerve impulse to the heart, intercostal muscles and pleura, and contract the respiratory muscles. So basically respiration is totally controlled by the brain, or let's say externally. But heart, it's not like this. So heart will control its contraction or generation of impulse for its contraction by itself. SA node will do that. I'm sure you learn in the advanced level, right? So in the SA node, electrical activity of this SA node we call pacemaker potential, right? So it can generate its own electrical activity. So pacemaker potential is a heart can initiate its own impulse. After each impulse, it comes to the firing level and spontaneously get next depolarization. SA node and AV node mainly will do that. Right. So just to refresh again what happened in the nerve. So we have resting membrane potential. From resting membrane potential to threshold, this part or firing level, to take the resting membrane potential to this level, we need some sort of external influence. If it is in the synapse, synaptic potential, and we will do some apply some external resource, or if it is in the nerve, some other nerve, if it is in the receptor, by external energy. So somehow by external energy required to make it to the firing level or to make it to the threshold, right? Nerve cell cannot do it themselves. ඒක තනියෙන් කරගන්න බෑ. So that is something important. To make it to the firing level or threshold, we need some sort of external influence. It is same for the skeletal muscles. So actually it's same for the cardiac muscles also. So here, if it is, even it doesn't mention from resting level to a threshold, it needs some sort of external energy, right? Then only it start the uh, voltage get sodium channel. But in the pacemaker cells, right? So just concentrate on this. This is the what happened in the pacemaker cells, and this is threshold. This is resting membrane potential. You can see it's a low value, about -60. In the nerve, it's -70. In the cardiac muscle, it's -90. So from resting membrane potential, actually it's called hyperpolarization. You can see, you can consider it as a resting membrane potential. To make it to resting membrane potential to threshold, it will occur spontaneously. So basically, to get the resting level to threshold, it doesn't need external help. Spontaneously, it will occur. So this will occur spontaneously, and that we call pacemaker potential, right? Pre-potential low, pacemaker potential, and then when it come to here, actually it's really start the action potential. Oh, so here this is the threshold value, right? So in the pacemaker potential low SA node, so that is the special ability of SA node. It can initiate depolarization itself without external help. So that is why it generates its own rhythm continuously, right? So let's say what are the ion channel important for that. So just understand here. This is we call pacemaker potential or pre-potential, and this is the real depolarization, and this is the real repolarization, and of course it come to the hyperpolarization, and then start next cycle, right? So there are several phases. At least here we have pre-potential or pacemaker potential, depolarization, and repolarization, right? As usual, repolarization here it's marked as a 3 by which channel? Potassium channel. As usual, it's happened in the nerve cell, muscle cell, cardiac muscle cell. This is due to potassium influx, efflux, moving of potassium out. So when it come to when it end this potassium efflux, that is phase 3 potassium channel, it opens some other special type of channel. It's very special. It's called H channel, or sometimes it's called funny channel because it's funny, right? With the H channel, it opens sodium as well as potassium, right? So if it is, you can understand if the potassium channel, sodium channel open, of course, sodium will enter into the cells and it will move upward, and it's like moving, it's like getting less positive O, less positive O, less negative O, positive. It's moving upward. If the potassium channel open here, it will make inside less negative, or it will move upward toward the threshold, right? Of course, this cessation of potassium channel also facilitate slightly upward movement, and then sodium channel open, and it says some amount of potassium channel also open here, but mainly I think main pose is sodium channel. If the potassium channel open, it should be opposite, right? But of course potassium channel also open, but here mainly this funny channel will transport sodium, but we don't call it a sodium channel. They have given a special name, H channel or funny channel, but it transports sodium and some potassium, right? Since it transports sodium, that will make it less negative. Minus 60 will move to minus 55. And minus 50 here. Minus 45. So in halfway, some other channel will open. So calcium channel. Since we have two type of calcium channel, the first calcium channel we call transient calcium channel. Right. So somewhere here, transient calcium channel will open. When calcium channel open, calcium will move from where to where? High calcium concentration outside. So calcium will move into the cells. So that will facilitate less negativity and will move further less negative, maybe 35, minus 35. Sorry, minus 45, right? So that is due to calcium, transient calcium channel, right? Of course, funny channel also might last, but now mainly the job of transient calcium channel and move it to the threshold. So when it comes to the threshold, long-lasting calcium channel will open, and this is due to some other type of calcium channel, long-lasting calcium channel, and will depolarize with the long-lasting calcium channel. So remember, this depolarization in the pacemaker potential or pacemaker cells is not sodium, right? Usually this part is sodium. The heart muscle now, skeletal muscle, this depolarization is sodium, but here it's a lasting calcium channel. Okay, so it come to depolarization and come to a certain level and stop here, and repolarization start as usual with the potassium, right? So here you can, few things you need to understand here. One is threshold is less. Sorry, resting level is less. Actually, we don't call it a resting level because in the heart SA node, there's no real resting. One start and next one start. One stop, next one stop. We can call this a hyperpolarization. No, of course, you can consider this a resting. And threshold is, of course, 40, considerably low value. And then this is due to not sodium, long-lasting calcium. And this pre-potential or pacemaker potential is due to a channel. We don't call it sodium channel, remember, because it's a special channel. It's a very funny channel because it transports sodium as well as potassium both. So we call funny channel and transport sodium and some potassium, and then continue with short-lasting calcium channel here, come to the threshold and open long-lasting calcium channel, right? So that is what happened in the pacemaker cell, so SA node, right? The same thing, you can see this in the Gannon. This is diagram from Gannon, and you can see minus 60. Either you can call it a resting membrane potential or something else. And here is the threshold. And to make it threshold, this funny channel or H channel is important, and short-lasting calcium channel is important. Of course, this is a some sort of potassium movement. And then this is the main channel for the depolarization, long-lasting calcium channel. And here it start again, potassium channel as usual in everywhere, repolarization by potassium channel here, right? So try to understand this. This will occur spontaneously. So this will, potassium channel open and come to this hyperpolarization, and spontaneously it will go up to here, right? And next cycle will occur spontaneously, and next cycle will occur spontaneously, and this will go on, and continue until you die, because SA node electrical activity will last until you die. So it generates impulse continuously until your heart stop, and this will occur this prepotential or pacemaker potential is very important to make it spontaneously to the threshold, right? Okay. Right. So the same thing you can see and you can read this prepotential, pacemaker potential, important channel. And yes, I explained these things. Right. So I have limited time. I will say 10:20. Right. So and in this diagram also you can see in the Ganon, and this is SA node. Is the SA node potential or action potential? This is the SA node action potential, and these are from different muscles, atrial muscles and ventricular muscles. You can see in the ventricular muscles typical shape that we learned earlier. Myocardial cells. In some places, like atrial muscles, shape is not exactly the same. As example, in the atrial muscle, we don't have plateau like this, right? So here in the, let's say, these atrial muscles, there's no real plateau, right? It's almost like a this just repolarization by potassium, and almost like a skeletal muscle or nerve cell. But in the ventricular muscles, we can see very clear, broad plateau due to calcium channel. Right. So, so try to understand this potential shape is not exactly the same throughout the heart. Right. And it related to ECG. You will have some other lectures, and then you can understand why this ECG and what's the relationship with this electrical property and the ECG. Right. Then, of course, we have SA node. It can do job. It can do its own job and generate impulse. But we will not let the SA node to do everything. Right? Then we don't have control. Our brain, and externally we should control the heart rate. So SA node and AV node get the sympathetic and parasympathetic supply. So you learn about the sympathetic, parasympathetic in the foundation module, and through the vagus nerve we get the parasympathetic supply to the SA node, and of course to the AV node, and through the sympathetic chain, both sides you learn it, and we get the some sort of sympathetic supply to the SA node, right? So what happened when we get the sympathetic discharge to the SA node? When the sympathetic nerve discharge and there's a receptor, beta 1 receptor on the SA node, with the stimulation of this receptor, what we can do is, probably you remember here, we have here funny channel, F channel or H channel. So we will make it quick action or activation of this channel. Or basically sodium conduction of this this funny channels will be quick. So therefore, this, when it quick, it can quickly come to the threshold. So if I draw drawing, so let's say here you can see this one, and then normally it takes some time. But when we activate sympathetic system, this will be very quick and will quickly come to the threshold. And this is what happened here. Repolarization and pacemaker potential start quickly and go up quickly. So what happened when, because of this action, next cycle start with a very short time gap. After this one is start with a very short time. As example, here gap is long, and here gap is short. Right? Because of this activation of sympathetic system, sodium conduction in the funny channel or sodium conduction is quick. So what happened to the heart rate? Here you can see it's narrow. Narrow mean So this is actually heart rate. This cycle, this cycle, this cycle, several cycle. Narrow mean heart rate increase. Next cycle, it start quickly. So SA node discharge rate will increase by the sympathetic discharge. When we stimulate sympathetic system, this will occur. Of course, neurotransmitter, no adrenaline will secrete and beta receptor will stimulate, and that will facilitate sodium conduction in the funny channel. And that will facilitate quick, that will generate next cycle very quickly. So rate will increase and time between two cycle will be short. So that is by sympathetic. Then when the parasympathetic discharge come, this will be opposite, right? This will be opposite, and when the parasympathetic discharge increase, this potassium conduction will be prolonged. And only here it start to come to the opening of funny channel. So potassium conduction will prolong and repolarization, or actually hyperpolarization, will occur for considerably long period. And then only it come to the pacemaker potential. So here gap increase compared to this gap increase. So between two cycles, gap or time in between two cycle increase. Then what happened to the heart rate? Discharge rate of the SA node will be prolonged, right? So parasympathetic will decrease the heart rate. Sympathetic will increase the heart rate. Sympathetic will increase the SA node discharge rate. Parasympathetic will decrease the SA node discharge rate. SA node discharge is the heart rate, because that is the electrical activity generate, and that will spread throughout the heart, right? So that is what basically happen. So I know I am using your tea time, unfortunately, right? So SA node discharge generate rhythm, and it will conduct to AV node and spread throughout the heart. So SA node discharge rate increase mean heart rate increase, right? So same thing, some other diagram you can understand easily why we get the increased heart rate, decreased heart rate. So SA node, so this is the location, right? Most discharge most rapidly, and depolarization is spread throughout the atria and through the conductive system and through the internodular pathway to AV nodes, and from AV nodes to ventricle, right? There's no other way to electrical activity move from AV node to the ventricle. Only this pathway, right? And of course, all this conduction, it will take time, right? In this diagram, it say if the SA node generate at the 0 time, it takes 0.03 second to come to the AV node. But from AV node, it take 0.16. So considerably high delay at the AV node. So most delayed place in the conductive system is AV node. හොඳටම slow තැන. right? දන්නවනේ දැන් අපි පාර යනකොට සමහර දැන් තියෙනවා බ්ලොක් වෙලා හොඳටම slow වෙන තැන්. බොරැල්ල හන්දිය වගේ, right? So AV node is the most delayed place in the conductive system. And of course, that is due to low gap junction, because electrical activity move through the gap junction. And that delay is very important, because that delay will facilitate, make it contraction, delayed contraction of the atria and ventricle, right? First atria contract and AV nodal delay, and then because of the delay, ventricle contract after some time. That after some time is important. for the ventricular filling, right? So therefore, this AV nodal delay is very important, and that delay is due to low gap junction. That is the most delayed place in the conductive system, right? And this is the location of the AV node, and you can read them. And usually, this electrical activity will not re-enter to the atria. But in reality, some condition we call atrial flutter, electrical activity will re-enter to the atria and make rhythm abnormalities. But usually, SA node, then come to the AV node, go to this conductive system and throughout the ventricle, right? So that's it, and I make it quick to make it fit to a 40 minutes. And you can leisurely read and try to understand this thing. As a concept, there are two important concepts. One is this one. What happened? What is the electrical activity of the myocardial cells, myocardial fiber, right? And then this plateau pace is important. It take time, and that time is important. And then pacemaker potential, here spontaneous pacemaker potential or pre-potential, and the depolarization is mainly due to long-lasting calcium channel, not due to sodium channel, right? We have some sodium conduction, but that's not a sodium channel. We give special name, H channel or funny channel, which facilitates sodium as well as potassium. And then we have short-lasting calcium channel. This two channel will make it a pre-potential or pacemaker potential to make it spontaneously come to the threshold, and then voltage gated calcium channel long lasting will open and make it depolarization, right? So that's it. So I will stop here. I hope you have some time for the tea. Okay, have a nice day.